Understanding Cervical Cancer Screening, a UCSF educational screening tool. You have the option of choosing the English module, Let's Talk About Pap Smears, or the Spanish module, Hablemos acerca del Papa Nicolau. Confidential. Why are you here? Click on the reason you're here. I'm here for a checkup, or I'm here because I had an abnormal pap smear. Have an abnormal pap smear? Don't panic. Before explaining what it means to have an abnormal pap smear, let's make sure you know what a pap smear is. A lot of women aren't sure. A pap smear is a test that looks for changes on the cervix. What exactly is a cervix? The cervix is part of the female reproductive system. Find all the parts of the female reproductive system. Uterus, where a baby grows. Fallopian tubes. Ovaries. Vagina. Cervix. The cervix is at the lower end of the uterus where babies grow. It's about 1 inch wide. The cervix connects the uterus to the vagina. What does a normal cervix look like? If you want to see a drawing of a cervix, click on the first tab. If you want to see a photo of a cervix, click on the second tab. Or you can skip. What is a pap smear looking for? Like the rest of your body, your cervix is made up of cells. During your pap smear, your provider uses a spatula and brush to collect a few cells. Changes in these cells may, in rare cases, lead to cancer. Finding these changes early means you can get the care you need to make sure they don't become a problem. The cells are sent to a laboratory where they're looked at under a microscope. This is what normal cells look like under a microscope. And these are the cells that are abnormal. Having an abnormal pap smear does not mean you have cancer. It just means that there are changes in the cells of your cervix that needs to be looked at more closely. What causes an abnormal pap smear? HPV. What is HPV? HPV stands for human papillomavirus. HPV is a very common sexually transmitted infection, or STI. In rare cases, this virus can lead to cervical cancer. HPV is different from HIV, which stands for human immunodeficiency virus. This is a drawing of what the virus looks like close up under a microscope. How common is HPV? HPV is so common, about 80 out of 100 women will get HPV in their lifetime. Usually, a woman's immune system can fight off HPV, just like the flu. In rare cases, women do not fight off HPV, but in most cases, this does not cause symptoms or problems. Even for women who have had an abnormal pap smear, HPV will most likely go away on its own. So what does it mean to have an abnormal pap smear? Select each one to find out. Normal. Many people have mild changes in the cells of their cervix due to HPV, which need to be followed but will likely go away on their own. Abnormal. Some people have more advanced changes. These are likely to go away on their own, but a closer look is needed. Having an abnormal pap smear does not mean you have cancer. Very few women with an abnormal pap smear will have or get cervical cancer, but you need to make sure you get the care you need so you can stay healthy. Okay, I have an abnormal pap smear. What happens next? The next step will depend on the type of abnormality on your pap smear, mild or advanced, your medical history, and your age. What are some of the options your healthcare provider might recommend? Another pap smear in 6 months or a year, or an HPV test, or a colposcopy to look more closely at the changes on your cervix. What is a colposcopy? A colposcopy uses a microscope on wheels to get a closer look at your cervix from outside the vagina. This enables the provider to see abnormalities and collect a biopsy if necessary. What is a biopsy? A biopsy is when your healthcare provider collects a small piece of your cervix, about the size of a grain of rice. The sample is sent to a laboratory to be looked at under a microscope. It gives more information than a pap smear because there are more cells for the healthcare provider to look at.
What happens after a colposcopy? This depends on what the biopsy finds. You may need an additional test in 6 months or a year, or another colposcopy in 6 months, or a procedure to treat the changes. Most women with changes in their cervix don't need treatment right away. That's because the changes usually go away on their own as women's bodies fight off HPV. If the changes don't go away after 2 years, you may need to have a procedure.
What are the procedures I may need if the changes don't go away? For those who do need a procedure to treat the changes, your healthcare provider will remove the abnormal cells either by freezing them, called cryotherapy, or with minor surgery, called a LEEP, laser or cone. The type of treatment your healthcare provider recommends will depend on the type of abnormality, mild or advanced, your medical history, and your age. Questions you may have. Are there any treatments for HPV infections? There are no treatments available for the HPV infection itself. There are treatments you might get if you've had an abnormal pap smear. Did my partner pass this along to me? If you've recently found out you have HPV, it does not necessarily mean your partner has been having sex with someone else, even if you've been in the relationship for a long time. Does my partner need to go to the doctor? If you have an abnormal pap smear, your partner does not need to see a doctor if he does not have symptoms. Most men carry HPV without having any symptoms, and there's no treatment anyway. If your partner is male, if you have an abnormal pap smear, your partner does not need to see a doctor if he does not have symptoms. Most men carry HPV without having any symptoms. If your partner is female, she should get her recommended pap smear. Do I have to tell my partner? Your partner can be a good source of support if you're worried about an abnormal pap smear, but it's up to you if you want to tell your partner. Why did I get an abnormal pap smear if I had the HPV vaccine? The HPV vaccine protects you against most of the dangerous HPV types. There are a few types not in the vaccine, and you may have been infected before you got the vaccine.
What else can I do to help protect myself and others? Select each one.
Follow up with all of your medical appointments.
Get vaccinated. All males and females under age 27. Ask your provider if you're age 27 to 45.
Protect yourself. Use condoms. Stop smoking. Smoking increases your chance of getting cervical cancer. Get tested for sexually transmitted infections.
Make sure kids and grandkids ages 9 to 26 are up to date on their vaccines. In addition to protecting against cervical, vulvar, vaginal, and anal cancers, research shows the HPV vaccine can also prevent a number of penile and head and neck cancers. Is the vaccine safe? Yes. Millions of doses have been given worldwide, and it's shown to be very safe. The most common issue is pain and swelling at the site where the shot is given, similar to many other adolescent vaccines.
Nervous about talking to your healthcare provider? Don't be nervous. It's okay to ask questions. Here are a few to get you started. What type of changes on my cervix do I have? Are they mild or more advanced? Should I come back in 6 months or a year to be checked again? Or do I need to do something sooner? Why? How likely is it that the changes on my cervix will go away on their own?
Takeaways. So, what key points should I take away? HPV infections are common, and most go away on their own. Very few women with an abnormal pap smear will ever get cervical cancer. HPV vaccines. Age 26 and under, get vaccinated. Age 27 to 45, talk to your provider. If your pap smear is abnormal, your provider may do a colposcopy right away or repeat a pap smear in a few months. Want more information? Talk to your healthcare provider about what options are best for you. You can also check out some online resources. Thank you. Take a quiz on cervical cancer prevention. Click here. Return to the beginning.